Welcome back, everybody. Today, hope you're doing well. Serious topic today. What are the risks of anesthesia for my pet, and how can they be mitigated or minimized? So, I think I had a question about anesthesia earlier. I mean, anesthesia, I always say, the moment that anesthesia you're cavalier about is the moment you shouldn't be doing anesthesia anymore. So, we at PetWow, and I think every vet hospital takes anesthesia really, really serious. We of course, our vets are trained, our staff is trained, our equipment is state of the art. We keep up with, just all of the things that go into maintaining an excellent anesthesia protocol, from maintenance to monitoring to one-on-one. Pets at PetWow, from the moment they're sedated to the moment they wake up, there's somebody with them, and that personal makes all the difference in the world. If there's a problem, there's the ability to react immediately. So that makes so much of a difference. So, but to answer the question, I mean, of course, risks of anesthesia are, generally lifestyle of the dog. Are they older dog? Are they obese? Are they overweight, underweight? I actually would prefer to have an overweight dog than an underweight dog for anesthesia if I had to. But honestly, most of the time we're forced into anesthetic decisions because there's something either life-threatening with the pet or something where the benefit just simply outweighs the risk of anesthesia. So, to minimize those, of course, a great physical exam, looking for any issues, looking at history, making sure there's not something that we've missed in the past. We always recommend preoperative blood work on pets, just to look to see if there's anything internally that we can't find in a physical exam, like kidney function, liver function. If there's electrolytes that are out of balance, those are the kind of things that can cause anesthetic complications if you don't know about them. So, we always try to put as often as we can to recommend to do IV fluids during that for two reasons. One, it keeps blood pressure up, but also it gives us immediate vascular access. So if the pet has a problem, we can administer medications knowing that the IV is already in. So certainly in older pets, we always press that. So those are kind of just standards of care that generally are accepted. But I think it is. I mean, I do think anesthesia. The medications are pretty standard across the industry nowadays. The anesthesia medications. I mean, the medications that I learned when I graduated 23 years ago, many of the medications aren't even available today. Like, that's just how far anesthesia has come. The medications that we induce anesthesia with are so safe nowadays. That's one of the reasons why anesthesia reactions and issues, while they do happen, anybody who does anesthesia is lying to say they've never had an issue during anesthesia, but it's extremely rare. And a large part of that really is that the pharmaceuticals have just come so far. In fact, many of the drugs we use nowadays, they didn't even exist when I was in school just a few years back, and some of them are relatively new on the market in the last several years. So they're really effective and great, but it does take a full team. But I think the team, the exam, the history, your things like blood work, fluids are the things that you can control when you're dealing with anesthesia. And even in our really old patients that just, we have to do anesthesia, it is extremely rare to blink an eye. They usually they do great. So, so not to say, again, like I said at the beginning, that doesn't mean you should take every anesthesia case serious. Don't be cavalier. But it is nice nowadays that it is so safe. So, so I hope that answers the question. But when it's your pet and they're on the line, it's okay to be nervous and ask those questions again. We're at PetWow. We're happy to answer them. Thanks now.